Diabetes mellitus, Dr. X, Mr. D, and most commonly known as diabetes, are all examples of a nickname of a lifelong disease that affects hundreds of thousands of people across the world. The purpose of my speech is to inform the audience of the history of diabetes, as well as changes of insulin today. As somebody with more than 2 years of medical experience and family members also diagnosed with the disease, I believe that I can bring an accurate representation of the history of diabetes as well as insulin changes today. In this speech, I'm going to go over the history of diabetes, how diabetes is categorized, and changes in insulin and how they affect us today. Now, to dive into the history of diabetes, the word diabetes was first coined in 250 BCE by the ancient Greeks. That roughly translates to pass through. Before this, diabetes did not have a diagnosis and did not have a treatment plan. It was viewed as poor eating habits and low physical exercise. We fast forward to the 20th century, where diabetes is recognized and insulin was created to help diabetic patients. Now, move over to 1970, where the creation of the insulin pump was used to help lower glucose levels and to help lower pancreas attacks by white blood cells. Now that we've gone over a little bit of the history of diabetes, we're going to go into how diabetes is really categorized. On the one hand, you have type 1 diabetes, which is caught in early childhood and is often when the white blood cells attack the pancreas as well as the cells that create insulin, as insulin is something that is naturally produced in our bodies. And on the other hand, type 2 diabetes completely depends on your lifestyle habits, your eating habits, your physical activity, and sometimes it's just purely genetics. Now that we've gone over a little bit on how diabetes is categorized, we're going to go into the evolution of diabetes today, as well as insulin today. In 1922, insulin was first discovered and utilized for the first diabetic patient, as it is considered the first successful injection of insulin in a diabetic patient. And now, in 1950, when the first insulin pump was created, helped lower glucose levels and monitor blood sugar, and increase longevity in diabetic patients. Now we fast forward to today, the 21st century, where we have monitors the size of wallets that can help monitor glucose levels, sugar levels, and alert the patient if needed on any of these sudden changes. In more specifics, today, 2024, we have Bluetooth devices, apps, and just even smaller devices that could help diabetic patients in alerts, access to medical care if needed, monitoring blood sugar, monitoring glucose levels, any major drops or spikes, and it's just at the touch of a screen. Now that we have had these changes, it has helped diabetics increase life expectancy as well as better management of this disease. In conclusion, I just want to bring up the fact that we have talked about a little bit of the history of diabetes, the categorization of diabetes, and how insulin has pretty much changed and helped diabetics across the world. Now, I understand that it is a scary place and it is a scary disease that affects many people, but thanks to advancement in technology and advancements in diabetic medicine, we have seen great changes in those patients as well as increased longevity, which is important for everybody. I just want to make sure that everybody gets themselves checked out regularly, as well as make sure that you are making those healthy lifestyle changes.